Tactical Combat Casualty Care is divided into 3 phases, the first one being care under fire. In this one you have effective enemy, hostile fire in your direction or at you, that if you chose to treat, it would become like a high probability for you or your comrades to become injured. And so in that we teach to secure fire superiority first and foremost, and if you're hit, you're able to apply a tourniquet on yourself in order to make sure that you don't die from blood loss. It's pretty much the only intervention that is taught in care under fire. In phase number 2, which is tactical field care, that is in which you have a little bit more leeway, a little bit more time, and you have a few more interventions where you can really take the time to address any massive blood loss, any kind of airway, or any kind of chest trauma that can occur. That also goes with like any minimal bleeding to head or hypothermia that can set in. And that's where there still may be enemies firing off into the distance, but it's not effective firing at you. And so that gives you the time to get in there and treat and try to save a life. And then tactical evacuation is just geared towards checking the interventions that you've already sustained, and then getting them to CAS evac or something like that, or medevac, to get them to a higher echelon of care. When you look at national defense strategy, when you look at, as an organization, trying to secure the competitive advantage, decreasing our losses and maximizing our offensive force is paramount. And Tactical Combat Casualty Care course highlights the 3 highest causes of preventable deaths, and it teaches medics and it teaches all combatants across the DoD how to treat those preventable deaths. So that way, our brothers and sisters in arms are able to come back to their families or redeploy and get back to the fight. It's no longer, a force where you call out or you look for the medic. TC3 equips every member with a tool to be able to save lives.